Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Wednesday, September 11th, 2024. And just in naming that date, it's been many, many years, but we know for this country what this date signifies and the memory of the lives lost on 9/11, the attack on America. And so we just want to name that as well, sort of on a total different end of the spectrum. Today is a good friend and sister's birthday, Deidre Stubbs. I would like to say happy birthday to you when you go back and maybe watch this after. And so today, for the past few weeks, I have been teasing this notion that we were going to make an announcement today, and we're going to get to that. But we have I won't say guest in the room. She's been with us. I believe this is her third or fourth time in the Java Cafe. And we are here today to speak about a couple of things. One is an event that's taking place with the governor and the lieutenant governor tomorrow. I'll be working in the background, getting some things together to show it, but we'll get the information from Maureen Scott Chandler today. She's coming in. She's been with us, sharing often resources that the agency that she stewards gives to the community. I've been hinting at a long nonprofit agency in the city, and we're going into partnership with, and we're going to announce that partnership in just a few moments. And so I would like to bring into the room our friend, our resident servant leader. That's your new title here in the Java Cafe, our resident servant leader.
Thank you. Thank you. So great to be here. Always.
Absolutely. I'm glad to have you here, Sharon. And over the past few months, the last time you were here, I've had the opportunity to work with your staff and agency there, and we're going to share something in a few minutes. But first, let me ask, how are you doing? There's a lot of things going on there at ABCD. You just did the big thing with the MBTA. You have Hoop Dreams coming up tomorrow. We have a big event next week, all along while you're helping families day to day with just a myriad of support in the community. And so with all of that, greet the audience as you always do, and we'll jump into what's going on tomorrow night.
Well, good morning. And again, thank you for having us on the show. As you said, what we do is all about community. And so through your show, through your partnership, we are able to share the programs that we run and that can help community. The services we have are centered in community in all of our neighborhoods across the city and in the Mystic Valley area. And it's just great to be here again with you and your audience.
I am so glad to have you here. And again, I said I'm going to be in the background, at least trying to get the graphics ready. But more importantly, what is going on tomorrow night? Sharon, I don't remember the exact year. You invited me last year and I wasn't able to make it, but I'm going to, pop in tomorrow.
Yeah, so this is
all night.
Yes, we're so glad to have you. You can get on the court, play a little bit if you want. But this is our annual Hoop Dreams event, which we partner with the TD Garden to bring companies to play in support of our youth programming. So any of the funds that we raise are going to our youth programs. And it's really it's a fun event, but it also gives back to the community. We have our co-hosts who are Bob Ryan and Brad Stevens, obviously the president of Celtics basketball, and Bob Ryan, a legend in sports journalism and in Boston. So they have co-hosted it and also in the past, Doc Rivers he couldn't make it this year, but it's really a nice event to get everyone back together, give folks an opportunity to play on the parquet, and all for a good cause. And that is ABCD and its youth programs. As you said, we have the governor and lieutenant governor coming to join us and kick us off to start the event. So we're glad the governor came about 9 years ago when she was attorney general. So she's not new to the event, but we are so glad that she's back. And both of them, we hear are basketball. Well, we know are basketball players. So
absolutely,
it's going to be fun to have them with us.
I'm going to go ahead and put the link in the comments. And of course, it doesn't want to work with me. I'll get that in there in just a few moments, because we've been spending a lot of time preparing and doing something else with ABCD. And so we'll make sure, folks, we share the flyer and also the website. I believe it is at capacity today. I'm not sure, or for tomorrow rather. But what I will do is put the information out, and folks can sign up for next year, definitely, because this is a long-standing big event, and being able to play. And this year, is it just a little bit different, Sharon? Being in the garden, let's say it like a real.
Well, we can all feel like champions this year, right? Now, you're absolutely right. I mean, I think the aura, the excitement of our championship year is really going to be present. And I'm sure that Brad is going to talk about that, and he's going to dialogue with Bob Ryan. So it is different. It is certainly different from the last, 13, 14 years that we have done it. It's going to be a great event.
I'm looking forward to being there. And again, folks, we'll get the information and the website and the flyer on our different social media pages for you. Speaking of social media pages and with ABCD, Sharon, we're here today to share that we are, I wish I knew what button was the drum roll, but we're sharing today that we are going into partnership to work together. First, let me back up a little bit. For the past 2 years, as you all know, I've had the opportunity to host the Joseph Betancourt Health Fair at one of ABCD's properties in Roxbury at the Thelma Burns building. This year, some of the ABCD staff came, and we were trying to get emails together to get them to come, and they came and said, "Oh, Jimmy, you're doing some great stuff in health here." And we started a conversation, and that resulted in us, sharing this partnership today. And so, folks, we'd like to share. I don't know, Sharon, if you want to, you're the CEO, I'm the partner. If you want to share it, but I'll give it to you.
Sure. Well, and you can definitely chime in. You are the major partner, but we know that you've been involved in community health for a long time, and it's an important issue for you. And as you said, we see it and saw it as an opportunity to really share more with the community, really gain visibility for not only ABCD's health services, but our subrecipient network, who are our health centers, hospitals, school-based health centers, get visibility for them so that people can access. We know that sexual reproductive health and maternal health are such important issues that this allows us all both to really amplify our voice in this space and talk to folks and be with community and really engage around such important issues. We know there are disparities, we know there are challenges, and we can only combat them together. And so this partnership is exciting. We appreciate your graciousness in partnering with us, and we're excited to kick it off.
Absolutely. And so today, this is through, and again, this is through a partnership with ABCD, sort of trusting our familiarity with community and young people and culture. And so we are really taking, and for those that are familiar in the public health space, sort of a harm reduction approach. And really, Sharon, one thing about ABCD, and you always talk about this, is meeting people where they are. And so I've been allowed a little bit, this is my voice, Java with Jimmy. I've been allowed some flexibility to take that experience. And we're announcing today that we are launching a public health campaign in partnership with ABCD. Right now, we're leaning on the terms, it's fall. And some people, there's a term that some of the young people and different folks use called cuffing season. But with all of that, the importance of this campaign is to make sure that you quote unquote cuff safely. And so in just a few moments, we're going to bring some folks in, your health services department director, as well as one of the sub recipient grantees, Andres from Clinic X, up there in Codman Square in Dorchester, to really talk about some of the stats and why there's this sort of aggressive effort. And, partnership for ABCD is not new, but in this space of utilizing social media, we have a great partner, the Real Boston Media. I didn't tell the team yet, but we just secured Mo Filla, who's a popular personality that's going to be in support of this campaign as well and be at the event. And so we're going to go more into that in just a few minutes and some of the numbers, but most importantly, the information that ABCD and the resources and Maureen will go deeper. But Sharon, did you want to share one of the major things that may be coming with this around some mobility in getting services in the form of a kiosk?
Yes. So you mentioned it. Young people accessing sexual reproductive services is so important. And so one of the things that the team came up with and in working with others was we're piloting 2 kiosks. So these big, for those who don't know what a kiosk might be, I when I first heard it, I was like, what is a kiosk? There are these sort of this equipment or almost like a soda machine or something like that.
I love the demonstration, Sharon.
Oh, it's big. It's big. They are going to be outside 2 of our ABCD locations. So Parker Hill Fenway at 714 Parker Street, and then also our our Roxbury North Dorchester Neighborhood Service Center, which was right next to the Thelma Burns building. So we are and I say piloting because, if something is very successful, then you figure out a way how to expand. But for the moment, we have 2 kiosks that are going to allow folks really 24-hour access to sexual reproductive health kits. And I'll say it this morning, right? Young people are listening, condoms and safe sex kits and STI kits.
Yep.
So that folks can test right away. Pregnancy tests will be in there. Feminine hygiene pads and tampons and things. So a lot of items that people can just access for free and anytime that they want and anonymously. I mean, we're not, many people are reluctant, especially young people, to go in somewhere and say, oh, I need an STI test. I need to find out if I have a sexually transmitted disease, or I want a pregnancy test. I might be pregnant. This is a way to do it really confidentially. With those tests and with those materials, there are resources to connect them to health centers, to connect them to places. So if they find out that something is positive, they know where to go. Obviously, they can always call us, ABCD, as well. But we have a lot of information about our partners in the health centers and other places and resources that people can use. So Absolutely. We're excited, and we're excited to partner with you on spreading the word.
I'm excited about it too. And we're getting ready to bring in Maureen and Andres. And so I'll let you cross over with them for a second. And then I know you're going to do other things and finalize and get ready for tomorrow, as well as the day-to-day stuff that, you oversee there at ABCD. So I'm honored. I'll be very honest and transparent. We were putting some things together last night, and I was talking to one of the team and I said, we're actually putting together a public health campaign. And so thank you for this opportunity, sharing your team, Jamie, Lee, and others, Maureen, definitely there, and others. I know I'm missing some names. I just met Darren via email as well. And so I'm looking forward to this partnership and hopefully continue as we do our best to decrease the amounts of positive STIs, the spread of HIV, and also unwanted pregnancy, and all of the things that come with the lack of equity around sexual health. Us growing up, we heard a lot about this. and it's changed somewhat, and so we have to make sure that we get the information out. So again, I thank you for this opportunity. Maureen and Andres, I'm going to ask you both to get ready just to come say hello to Sharon, and then we're going to do a little deeper dive into some of the numbers and why, Sharon, you and your team is sort of going this way based on what we're seeing in various data trends. We're going to do a brief overview today, and then as the campaign rolls out, we're going to share a lot of information. Last thing I'll share with you all is we will get to be with Sharon next Thursday night. We are, and I know a lot of you have been waiting for this to drop, for the link. And so we're going to drop it right after the show or maybe during the show. But make sure that you come out next Thursday night. There will be networking. We'll have some complimentary eats supplied by the Mix. And also we're going to have a DJ. We'll hear a little bit from Sharon and Maureen, and we're going to share with you the campaign and ask you to join us in community to make sure that we decrease the amount of STIs and HIV, unwanted pregnancy, and help people understand that there are resources available for sexual health. And so I'm going to bring Andres in right now, and hopefully Maureen will come in a second. I know sometimes, oh, there she is. We got her. Okay, so Maureen and then Andres. I am so glad to have both of you here, Sharon, Maureen, and Jamie and others, but we've been on the phone. We've been in emails. We've been on Zoom trying to make sure that we move in excellence to get this information out. And so Maureen and Andres, go ahead and say hello to Sharon as well. And then we'll go a little bit deeper into the conversation with the two of them.
Good morning, Sharon. Good morning, Andres.
Good morning, everyone.
Good morning. Yes. Well, again, Jimmy, I appreciate our partnership, and you're doing this, and I'm going to leave you to the experts because, as you said, they do this work day in and day out, have been doing it for many years, and we're so blessed to have the programs that we have, and I thank you for your partnership.
Sharon, thank you so much, and we will see you. I was going to say next Thursday, but we'll see you tomorrow evening.
Yes, we will. All right. Take care.
Thank you.
Thanks.
So, folks, as we just shared, I've been teasing this, and we've had the opportunity. I met Maureen some weeks ago, a couple of months ago via Zoom. I'm meeting Andres today, and we have talked, Maureen, and been teasing. I appreciate the flexibility that, Sharon has allowed me to be a little take a harm reduction or real approach to reaching the population we need.
Yes,
and we're officially launching this campaign called It's Cuffing Season, Cuff Safely. And so first I'll ask you to please introduce yourself, and then Andres as well. And then we'll go just a teeny bit into a teeny bit of your journey and how you wound up in the space of public health. And then we're going to talk about the campaign and the numbers, our great event, the sub recipients that you work with there at the network. Andres is one of them at Codman Square, the X Clinic. And so that was a lot there. So Maureen, go ahead and say good morning.
Hi, good morning. Thanks for having me. Thanks for this opportunity. I'm real excited. My name is Maureen Scott, and I'm a women's health nurse practitioner. I've been a nurse for 48 years and a nurse practitioner for 39 years. And I started my journey through maternal child health, and also spent a lot of time in adolescent health in the Boston Public Health Commission in the school-based health centers. And after retirement, I kept my job, a side job, which was at Codman Square Health Center in the STI clinic up until 2022. So that's my journey in a nutshell. I've always been interested in public health, STI treatment and prevention, healthcare, and have a long history of doing community presentations to all girl groups and to parents and grandparents on how to talk to their children about sexuality, puberty, things like that.
It's definitely evident in the conversation we had with Sharon and also my conversation with you that you were definitely an expert. I meant to say this when Sharon was on and you talked about it a little bit, but yes, our young people are concerned, but we're going to get deeper into this because some of our elders are concerned as well in this space.
So true.
Yeah, we're going to talk about it. Andre said, so Andres, please introduce yourself. Welcome to the Java Cafe. Maureen, have you been on before? Or is it because we've been on Zoom? I think you've been on. Is this your first time?
Because we've been on Zoom, but also my cousin was on your show, and maybe you see the resemblance.
Cousin.
Yeah, cousin Barbara Barrows. She wrote it about Tulsa.
A historian, the Black Tulsa?
Yep.
Okay, Andres, I'm sorry. We had a moment there, but Maureen, I didn't formally say welcome to the Java Cafe. You all welcome her and Andres here. Andres, the show is yours.
All right. My name is Andres. I'm the X Clinic supervisor, the X Clinic being the STI clinic at Codman Square. I've been here for 3 years now. Actually, when I was coming in the door, Maureen was heading out to do bigger things. I got into public health, I would say, in my time at college. I was a part of an organization called Peer Health Exchange, where we went into local high schools and taught about mental health, sexual health, consent, peer pressure, all these types of things. And when I was fresh out of college, I was like, how do I keep working in that kind of field? And so when I saw that the X Clinic was hiring, I was like, this is what I want to do. So here I am 3 years later.
I'm definitely glad to have you here. I just saw a little glitch, so hopefully everything will work well on my end. I'm so glad to have both of you here to speak with us. And so, Maureen, I'm going to start with you. In our conversations, we are aware that there are some very alarming numbers in reference to the rise of STIs and HIV, also unwanted pregnancies. And so let's have that conversation based on, and to keep me sort of a little bit in order, we shared a document with some of this information, and it is just, let's sort of maybe review that. And Andres, you can jump in as well. Where are we with STIs and HIV in reference to numbers? And unfortunately, from what I'm seeing, increases. And I was in Florida recently, and there's a big old campaign around syphilis. So it's not just here. And as the campaign rolls out, we're going to go more into the local data. And so can you just give us an overview of where we are?
Well, there has been an influx of syphilis. So it's 2.5 million cases of syphilis, gonorrhea, and chlamydia were reported in the United States in the past few years. The most alarming is the fact that syphilis has had an 80% increase since 2018. More in the area of congenital syphilis, which is children, babies that are born infected with syphilis. That can cause stillbirth, miscarriage, infant death, contributes to maternal and infant morbidity. The chlamydia and gonorrhea and syphilis infections have increased in the United States, and it's more disproportionately increased in gay, bisexual, and other men who have sex with men, and transgender women. So this is where we are with that. The increase in syphilis, we have to figure out why it's increased. I mean, the same things are going on. I don't know. I know Andres can talk to the people coming in for STI prevention, STI treatment. But why is this happening? Is condom use decreasing? These are the questions that I ask. So we've launched some campaigns. We did a funding with one of our, not one of our network subrecipients, but with another health center to try and increase access to getting STI testing and treatment. And they launched a big PSA, and they have a mobile unit. So we're trying to do our part with ABCD, trying to help out with this problem. I didn't mention that we are a Title X grantee, and we provide funding to 27 subrecipient health centers to improve their family planning programs, increase health equity, and just provide the highest quality of care. So I didn't put that in the beginning of what we actually do, what the program does.
Absolutely. And Andres there at Codman Square at the X Clinic is one of them. And so Andres, Maureen has been on the ground, but you're most recently on the ground, and she made reference to the fact that maybe you can, just from your awareness there around these increases, she talked specifically about syphilis, but what are you seeing on the ground when folks are coming in and testing in maybe in conversation, is a little bit of screening beforehand? What is it that you're seeing?
Yeah, I'm seeing definitely a lot of more syphilis, but really a lot of chlamydia and gonorrhea going around as well. And what I'm noticing is a lot of patients, the amount of education they have around STIs vary, and I think that's very reflective of the education system, and how sexual health isn't considered as important in some places, or places are only taught like abstinence only, not really safe sex. I have patients who don't even know how to use a condom sometimes, and we have to teach them like, how do you use this and what is its purpose. And so yeah, so that's what I'm seeing a lot of, just really the lack of education. Patients who also don't want to get their blood drawn. They think, oh, I'm not going to have any of those like diseases. I think I'm good there. I'm just here for chlamydia and gonorrhea. So there's also a lot of patients who are just not getting tested because they think they don't need it. And we have to go into that. Well, anyone can get it. Here's how it spreads. And it's just a lot of education.
Andres, let me ask you to that point of education. Maureen, I'll start with Andres here first. There was a time when I was growing up, and Maureen as well, where sex education and we had peer education programs. You talk about the fact that the use of a condom. I remember having to order a piece of equipment to take out in the community and actually show the young people how to do it. And I'm just, is it, and I don't want to get too far off. We have our notes and we all prepared, but I know that there's prep, and there's this notion that, you know, if I'm on prep, I'm all set. And then there's doxy prep, and we'll get more, and we're going to have some other conversations sort of after dark as this campaign rolls out and has some real conversations. But Andres, what from your observation, where are there still peer education programs? And then lastly, I'll ask, what are you observing in the demographic, maybe as far as age?
Yeah, I can start with demographic. The X Clinic sees all ranges of ages. The youngest we can see is 16. The oldest I've seen is like 70 something. So we're seeing a wide range. I'd say most of our patients are within 20s to 30s. So it is young folk who are coming in. As for peer services, so I know, like I said, I was in a peer education program like in college. That organization specifically has actually moved to just online stuff. So they're doing like TikToks and they're doing social media to promote education. I think we've moved a little bit away from the peer model to online is what
Online
I'm
system.
noticing.
Yeah.
I'm definitely having patients who are like, I saw on TikTok, or, you know, I Googled something. So I definitely think it's more just online.
And that's one of the reasons, Maureen, that we're going sort of into this partnership with partners like the Real Boston Media, Mofilla, and others that have this influence on social media. And so, Maureen, you saw my face, and we've talked about this because Andre said that, you know, they see someone as young as 16, and then he referenced that he saw a 70-year-old.
Very true. I was in the STI clinic where Andres is for 6 years. It's 5.5, 6 years, and 70 years old is not, it's not different than a 15-year-old walking in. So the, you know, the prime of life people, I call them, from there. Many times, and I know Andres can answer this, that they're repeaters as well. So
it's, you know, in our conversations, go ahead. I'm sorry.
I'm not sure if it's because I don't know what they're thinking, that they can't catch these things. Maybe they went through their life without ever getting anything. And, you know, I think it's more back when they were growing up, that lack of education was there. So you didn't think about it. You may have been in a long-standing relationship. You may have been married for a while, and now you're out there. But yeah, there's the older generation is right up there with the younger generation with showing, especially positive syphilis. Andres, you can answer to this, may have latent syphilis, that they've had it, they never were treated, and they're showing up now, and they've never had it tested or can't remember the last time, and they don't recall ever getting treated. So that was, I've noticed that a lot.
That is very alarming. And one of my Maureen and Andres, I don't know if you're familiar, but this term, one of our mothers, I have this mother's board here in the Java Cafe, and we referenced her as a mother, and she's in here saying 70. Yes, Sharon. And Maureen, I shared yesterday, and I don't know where it came from, or was it in I heard reference somewhere that even in a nursing home, that there's some demonstration of those that are, you know, sexually active.
Yes.
I remember the old adage, what is it? Just because there's snow on the roof don't mean that there's no fire in the furnace. And so while we're not jovial, but we made a joke there. This is a very, very serious.
Oh, it's serious. I've treated a woman 80 years old. And
which you don't hear about anymore. Back
right, and it's there. It's there, quite there. A lot of the thing about it is majority of men do not have symptoms of trichomoniasis. It's usually the woman that comes in with these symptoms that are very annoying and bothersome.
It is just very alarming. And this is not a one and done, everybody. We're sort of introducing sort of a macro sort of overview of where things are. And so, Maureen, I'll ask you, talked about the STIs, but let's talk a little bit about the unwanted pregnancies.
Yes. The pregnancy rate has overall gone down, but there's still the disparity in the non-white community. So even though it's gone down with adolescents, it has gone up and it stays, we know about the maternal mortality rate. We've been talking about that, how women are most likely to die almost 3 times as much as white women. But now we're talking about the maternal infant mortality, and infants can die 2 to 4 times more. The overall, I can quote some rates that the Black and Hispanic Latina females, as compared to white females, between the ages of 15 and 19, the rates are 21 to 22 per 1,000 compared to 9 per 1,000 white women. So the pregnancies, though they decrease, they kind of really stay increased in our neighborhoods. And with these increased birth rates also comes increased infant mortality, low birth rates, maternal morbidity. They're 4 times as likely, the infants are 4 times likely to die of complications related to both low birth weight compared to non-Hispanic white infants. And there was 9 times more sudden infant death syndrome in non-Hispanic as compared to non-Hispanic whites in 2020. So we still have a problem that we're dealing with. Having the kiosks can allow these adolescents who may be afraid, may be afraid of the stigma, or just don't know how to go and ask for a pregnancy test in the clinic. They have the free pregnancy tests in the kiosks. Early pregnancy tests that show positive or even negative with the scare is going to at least help them with the referrals to these health centers, get early intervention, prenatal care, which hopefully will show a better prenatal outcome and birth outcome. So hopefully that with the information that we're giving with all these safe sex kits and pregnancy tests, there's also Plan B, which we didn't mention in there. So you might wake up in the morning and remember this kiosk that's there, or your friend said, oh, this kiosk is down the street, they got Plan B. And of course, they call it the morning after pill. But that may prevent a pregnancy, a high rate of, preventing it if you take it within a certain time. So we have a lot going on. We have a lot of issues that as a community, a medical community, the public community, that we have to really work hard together to decrease these numbers.
Andres, let me ask you, Maureen, we're going to go a little bit more into, again, I can't keep reiterating enough that this is the beginning of a campaign that we're going to run right through the holidays, if not just a little bit longer, because we have to ensure that this information is out there. And that's the reference to, sort of cuffing season this time of year. And so, Andres, just let me ask you this. I know you're at the X Clinic, but just from your familiarity, are folks coming in for a pregnancy test as well?
Yeah, we get some folks, not as often, but we are getting folks who come in for pregnancy tests.
Okay. As we get ready to sort of wrap up this first sort of introductory, and there's some things, on more the technical, clinic side and things like that. But I thought it was so important just to have a real purview and just a realistic approach, Maureen, to where we are. And sort of level setting. And so, Andres, let me ask you, Sharon mentioned the kiosks are going to be confidential. But Andres, let me ask you, and Maureen, I'm going to ask the same maybe for some of your other grantees, and also talk about the network, and then we'll wrap up. But Andres, can you talk about confidentiality? If someone's listening today and they look up the X Clinic and they're wondering and they don't want, because let's be honest, there is some maybe concern. I don't want to use the E word, burst, but there's some, people aren't just running in happy go lucky. I need to get tested. And so the confidentiality sometimes is an issue that comes with that. Can you talk about how patients' confidentiality is protected?
Yeah, confidentiality is obviously super important when it comes to STI testing, especially when we have folks who don't have their own insurance. They're under their parents or they're under their partners, and they don't want like a bill sent home or whatever the case may be. There are several ways to like navigate around that. Massachusetts has the Patch Act, which is a way that someone can call their insurance and ask for their bills to be sent either electronically or to another location. That way, it can be avoided being sent home to their parents or the partner. We also have MyChart, which is like a patient portal where the patient can see their own results on their phone. They have their own access to that. Others can't access it, so they can see their own results. Or if they want a phone call with their results, the X Clinic in particular is open like after work hours and on Saturdays. So we have times where we can call a patient where they're more comfortable or more able to get their results. Um, and there's also in our electronic medical record, we have what's called break the glass. So we can mark a visit as confidential. Um, and what that means in the back end is if someone's trying to open this visit, they have to put in their password and it's notified through the system that, hey, someone's accessing this visit. Are they someone who should be in this visit, like someone who works in X Clinic, or is this someone else who's trying to get into this visit that shouldn't be there?
Definitely. Maureen, the X Clinic is just one of the grantees that you support and work with. I believe there's a network of this of about 12 or 13. And also we want to share, we announced the event next week, but when you come to the event next week, you'll be able to meet some of the folks that are in community that will be available. There will be resources there from ABCD as well. And so, Maureen, if you could just do a little overview about those health centers that is a part of the network where folks can go if they're prompted today or if they know someone that they've been talking to, or just talk a little bit about that network. And folks, all of this information is coming out later on where you can click and link and look up and get the information.
Well, we have 13 subrecipient health center agencies. And of those 13, we serve 27 sites. So some of the health centers, we may serve more than one department,
Yeah.
or also different clinics. Like for Boston Children's Hospital, we have the adolescent program and the young parents program, as well as Martha Elliott.
YPP?
So yeah, we have YPP.
When I used to be in the ER and CCHP and
Yeah.
go back. Yes.
All the right.
Yes.
And we have the Dimick Center, Codman Square, about Harvard Street, Mattapan. Most of the Boston health centers actually we cover. We also fund the school-based health centers through Boston Public Health Commission,
Yes.
which has 7 school-based health centers, and the school-based health center for Codman, which is Tech Boston. And we just got funded a new one, Boston Day and Evening Academy, which is under Whittier Street. So we're trying our best to build our partnerships. By giving them funding, we hope to pay the salaries of family planning counselors. So if they didn't have one, the salary is there for it. Also to fund their programs so they can improve it and enhance it, be it through education, workshops, community engagement. With the funding, they provide a budget of how they're going to spend the money and monthly invoices. So we also provide like education, training, free training to our network and also to the community.
I was going to ask out to the community as well.
Out to the community, there are some that is free. We have a family planning basic program. We have an advanced family practice training. We provide IUD and Nexplanon training through the pharmaceutical companies for free.
Let me
we
ask
have
you a
harm
question.
reduction training coming up.
Maureen, what is the IUD for folks that may not know?
The intrauterine device. It inserted into the uterus and it's left in place, and it helps prevent pregnancy. We also provide Nexplanon, which is the rod that goes in to the arm, which has hormone that comes out little by little to prevent pregnancy. That's the layman's explanation. Yeah. But it's private. You don't know, no one knows you have it. So we provide training to the clinicians for free. and then they'll be mentored in their health centers.
Andres,
So we're busy every day. We also provide a lot of clinical resource. I do talk to a lot of clinicians about information, and also information on medications, anything new trending. We send out mass DPH messages of any new guidance for things like monkeypox, doxypep. We have a clinical advisory council meeting coming up to talk about doxypep, for clinicians to get more information on that.
There is, I'm just flipping through
We're
a little
busy.
bit the things that we're going to share that is available through the network, and also some resource. All this information is going to be available. We're going to share the website as well, and the locations for folks to go with the kiosk. Andres, let me ask you as my last question to you, and anything else you want to share. You talked about, not having maybe peer education programs like we used to, using more. The peer education programs are now held in TikTok and Snap and in the Gram and whatnot. How important is it that you see that ABCD is taking this approach and moving with intentionality in social media on a community-based talk show? What does that say to you about ABCD's commitment to getting the information and, more importantly, the resources out there?
I think it shows that ABCD cares deeply about the community, and it really shows, and they know what they're doing, and they know how to reach their audience.
All right. Can you just close that out with a period? And we'll be all set.
Period.
No, it's because Maureen, I've been teasing, the folks we're going to talk. ABCD is one of the longest serving agencies in our community. In so many spaces, from heating assistance to Head Start to food assistance to housing assistance, and now, and making sure that we're around to take advantage of these resources, because at very worst, not diagnosed. You talked about latency. I've never heard latent means to be delayed. Latency with the computer sometimes happens.
And they're probably not even having any symptoms any longer, and they were lucky.
That's it. Okay, Maureen, you get me started. It's 9:47. That's the thing that I remember from being a peer educator about STDs back in the day. Oh, I'm not symptomatic. One of the number one symptoms was there's no symptoms. Okay, exactly. I'm gonna pull myself in before Jamie sends me a text and say, James, save some for for after dark. Yeah. But it again, folks, we want to ensure that you have this information. And one of the reasons ABCD is partnering with us, because more than just seeing a flyer and going to a website like today, and even deeper, we're going to have a few conversations between now and January. A few of them are going to be after dark. Right. Maureen has let me know that she's willing to have that real, because
we're going to go deep.
You have to, no pun intended. Those are the examples of, y'all need to come back for after dark. And because the conversations, people, think that they're the only one dealing with that situation and they don't want to tell anybody and whatnot. All conversations will let folks know you're not the only one, and this is where you can go to get help and remedy.
And this is where the kiosk and X Clinic is going to come in, because X Clinic is there. I mean, I know, Andres, you see people from everywhere. It's not just Boston. People who are traveling, people who are just coming for a conference, or they're here in school from other states. The X Clinic is there for them. And now the kiosk will be there for them.
And the X Clinic is also known for some intentionality for the LGBTQ plus community and the trans community as well. Correct?
Yes. Yep.
So that, it also goes to the intentionality of ABCD and its partnership to make sure that there's partners maybe with male clinics and adolescent and eventually y'all might have to partner with geriatrics.
With the nursing homes.
We're going to have that conversation. Let me just check a couple comments before we get ready to go. Look who's in the room. Your cousin, Barbara.
Yeah, she was coming on this morning.
So we definitely, Barbara, come back we have the After Dark as well. And so Maureen and Andres, Jamie, Sharon, Lee, and everybody, Real Boston Media, the Davis System, and others, we are excited today to just get ready to get this information out. Folks, don't forget, we're going to share the link. Maureen, I put a post up on Facebook a few weeks ago about this event.
Yes.
You know, and going by what, you know, your advice, James, you know, the uptick is in, you know, 21 to about 45 at that point, not realizing that the age was higher. Maureen, when I tell you the chatter on social media about this event, so there's going to be a lot of folks there. Someone asked me the other day,
come out, you know, we're there, we can talk, engage in real conversation over some good food.
That is some good food and some good music, and we'll network. And you know, if there's some cuffing going on there, you all will have the materials.
We'll have the materials. We'll have the things they need to stay safe.
With that being said, before this turns to After Dark, but no, seriously, everyone, we want to make sure you have the information and be aware, because to Andres' point, and Maureen as well, we can, Andres, I hope you appreciate this. Maureen and I can see the evolution of the up and down. Numbers go up, money comes out. Numbers go down, money goes away. Numbers go back up. And so, you know, for you to have that purview that you don't see as much of the peer model in moving to social media, this is why this partnership with various type of partners and diverse partners is so important to getting this out. So, folks, we're sharing with you today the launch of his cuffing season, Cuff Safely. There'll be more conversations and a lot of things on social media as well. Thursday, there'll be some giveaways, maybe give away a couple of drink tickets for you. And so please plan to come out on Thursday, meet Maureen. Andres, I don't want to put you on the spot, but you might be able to meet Andres as well if he's available. But some of the partners from the network to which Maureen referred will be there as well. So please plan to come out. We're going to drop the link in just a few moments. Andres, anything that we missed? I want to give Maureen the last word.
No, I think just look into your local resources and see what's around you when it comes to sexual health.
Simple as that. Period.
And
Maureen,
look out for these kiosks that'll be launching mid-September. Hopefully it'll be shown on Java with Jimmy when we do launch. And you know, utilize the resources that are out there, just like Andres said. Call ABCD if you have questions. We have a website that talks about trainings and where all of our locations for the family planning programs are all listed on our website.
I'm going to put that website up before we go real quick. Again, you all know, well, you all may not know, but the audience knows I've been known to do things in real time. But I'm no. Okay, here. Okay. I will put that up. I'll let y'all go run to a commercial and get that all set. But Maureen and Andres, thank you, folks. Don't forget next Thursday.
Thank you for having us.
Thank you for having us.
Absolutely. Thank both of you. And we'll see y'all. Maureen, you and I will talk soon. Andres, I hope to meet you as well. And thank you for all that you do there at the X Clinic. I remember within the past year and a half, there was someone I needed to reached out and I needed to advise them to come through. I was familiar with the X Clinic and they did. Unfortunately, yeah. So thank you for the service that you provided to them.
Thank you.
Thank both of you for being with us today. Jamie and others, thank you as well. And we're going to go and get ready to roll out this campaign. The last thing I'll say is when y'all see these flyers and stories and posts on social media, get them out there. Because as Andre said, some people just may not know.
That's right.
Thank both of you for being with us today.
Thank you. Thank you for having us. Bye-bye.
Folks, I hope you found this episode informative and a little bit alarming. A little bit alarming. This is why we're going into this partnership for folks that are on Twitter and I didn't even look at Instagram. For folks that are on Twitter and Instagram, it is imperative that we help get this information out there and talk as well. And so we have a whole bunch of information and we are really dropping a whole campaign to make sure that you are aware of the information. These are some of the services that are provided. This is about the kiosk. It will provide pregnancy testing with referral information for early intervention for pregnancy options, counseling, early pregnancy intervention, and also encourage early prenatal care, which is hugely important. Community Prevention Health Services provides cohorts to community teen programs on pregnancy prevention, STI education, and testing, self-esteem, and self-advocacy. So Maureen said they go out into the community as well and do those trainings. All of this information is going to roll out over the next few months. Don't forget to plan to come out. Let me go ahead. And for those of you that are watching today, hold on for 1 second. Let me go ahead and get the link. So for those of you that are watching, what is it? Twitter. I don't think you guys will be able to actually click the link. But here is the link for registration for this cuffing season launch. All right. There it go. So for those of you, Barbara Barrow said, I certainly will be there. There is the link right there. We only have capacity for 75. It is free. You do have to register on Eventbrite to attend. So make sure you sign up and get your seat. We're going to have great music. We're going to have I went over the menu with Aaron yesterday. And if you ever had food from Lobster King, or if you ever been to the Mix, there's some great food there. And so there is the link for you to sign up for the event. Now, listen, don't sign up and go to secure a seat and you don't plan on coming. All right. Give that seat to someone that needs that information. All right. That's it for me before I get to fussing. UCB, you all get an hour today. I don't feel like I've said that in a while. And that's it. All right. You guys have a wonderful day. And don't forget tonight, for those of you that may be going to the dinner group conference or may not have been able to make it to the conference, the dinner group after party is tonight at 5:30. So if you're going, we'll see you there. I believe they have some tickets left. So Google the dinner group and get your tickets. I'm not sure if they're selling any at the door. And I think that is it. We'll be with you tomorrow at 9 a.m. And tomorrow afternoon, we're with Uncle Thaddeus at 4 p.m. at the ICA, Institute for Contemporary Arts for Black Joy. So that's taking place with Uncle Thaddeus tomorrow, I believe at 4 p.m. And we'll update you about other things. Don't forget, tomorrow is our last day at 9 a.m. All right. Monday, 10 a.m. in the comments. Well, if you're on Twitter, hit that live chat. 10 a.m. starting this Monday, September 16th. The Java Cafe will open at 10 a.m., not 9. All right. 10 a.m., 10 a.m., 10 a.m. I did hear from Miss Teresa directly yesterday. She let me know that she is doing well. I told her she shouldn't have been on the phone, but she's doing well and she is recuperating. And so please keep her in your prayers. And I promise that's the last thing for me. So don't forget, everyone, next Thursday at 6 p.m. at the Mix. And this is where you can go and register. Registration is required. All right. You won't be out there sharing the link either. No, sir. Please let know. I just saw Tashad's comment. Y'all going to try to keep me on here till 10 o'clock. I can get Tashad's comment and get off, and UCB just get their hour. No, I'm messing. Tashad said, I know I'm going to still pull up here at 9 on Monday. Like, where's everybody at? Where is everyone? All right, Tashad, thank you and others for being with us today, and we'll see you again tomorrow morning at 9 a.m. Have a great day, everybody.